It is the first Wednesday of the month. I was going to say the first November of the month. No, it's the first Wednesday of November, ladies and gentlemen. Now, the first Wednesday of every month, we take your phone calls, we take your text messages on your pet-related questions. Do you have a dog or a cat? Do you have a pet? And do you have a concern and want some answers? Well, that's what we do every first Wednesday of the month. It's our pleasure to welcome Dr. Sophia Skoulikas onto the show, veterinarian in general practice at the Liesse Animal Clinic in Dorval. Dr. Skoulikas, welcome back to the program.
Hi, thanks for having me again.
Great to have you on. Let me open up the phone lines here. So 514-790-0800. If you've got a question about your dog or your cat or your pet, 514-790-0800. We take your questions right here, right now, and we'll be with you until 11:30 taking those questions. Get in early, though. I hate when we end up with 5 calls hanging right at the end of the segment. Okay, Dr. Skoulikas, I want to start off with you today on this subject, and it's about vaccinations. Now, a 2024 survey shows a growing number of pet owners that are vaccine hesitant. Of course, south of the border, we've seen vaccine hesitancy among adults. You could say the U.S. Health Secretary, Robert F. Kennedy Jr., he's very vaccine hesitant, to put it mildly. And from adults, it can also go to pets here. So I want to ask you off the top here, are you seeing that in your practice? Are you seeing more and more people who are hesitant when you say, oh, well, your dog needs this vaccine, your cat needs this vaccine? What are you seeing?
I am actually seeing more people that are a little bit more hesitant to vaccinate. Not that much, but there are a few that, are very worried about side effects, or very worried that we're vaccinating for no reason. And for sure, these are things that concerns that you want to bring up with your veterinarian, because with everything there are side effects, even though they are very minimal side effects and very rare. But generally speaking, you do want to vaccinate just because the benefits of the vaccines and the benefits of providing that immunization for your pet outweigh those risks that can very rarely happen.
Is the hesitancy coming, from like online information? Is it also coming from cost? Because I can imagine now when people's budgets are tight, they can find any reason to save $100, $200. I don't know how much, I forget how much the vaccines cost, but is money part of the issue here while people are saying, oh, well, do I really need that?
In some cases, it could be. Vaccines are usually anywhere between, depending on the vaccine, it's anywhere between $20 to $35. So it's not the main reason.
Okay.
I think the main reason is online, Facebook or Google, where people are thinking that vaccination is not necessary, and veterinarians are just kind of doing it just to get some money.
Is there one or two vaccines that you would say, hey, you know what? You've seen in your practice someone who says, no, I'm not going to get the vaccine, and then it ends up ending up in a terrible situation?
I have actually, more so for leptospirosis. I've
What's that?
seen.
Leptospirosis? What's that? Tell me what that is.
So, leptospirosis is a bacterial organism that is transmitted through urine, and it's transmitted by animals that harbor the disease. So, it could be rats, it could be raccoons, it could be skunks, it could be other dogs. Um, and basically, like if your dog will drink in a puddle of water or sniff the area of like peed on snow and then lick it, or who knows what, they do have a risk of getting that bacterial infection. And that leaves them with, it could be a pretty severe condition for them. It can affect their kidneys, it can affect their liver.
Hmm.
And in addition to that, it could also be transmitted to people. And the most devastating thing is that it can cause miscarriages and stillbirths in
Oh
women
my
who are
God.
pregnant.
Yeah. So you got to take that stuff seriously. Listen to your vet on
Yeah.
the vaccine front. Okay, let's go to our phone lines. Debbie is in Dollar des Ormeaux. Hi, Debbie.
Hi, how are you,
Good.
Elias?
What's your question for Dr. Skoulikas?
Okay, well, my cat has had a rash just on his stomach, one area, And on the inside of his leg for about 7 months, we've done every culture there is. We've had him on dexamethasone and all these different things that work for a while, but then it comes back. And now the vet says maybe it's environmental. They can't seem to figure it out. And we wonder if it could be from stress. It's just in 2 spots. We put cream on it as well. It seems to be doing okay right now, but just wondering.
What do you say, Dr. Skoulikas?
Yeah, so dermatology issues can be very frustrating for sure. The best thing to do, even if we culture or take a cytology, the best thing would be to biopsy. I'm not sure if a biopsy was done where an actual piece of skin is taken and sent out to be analyzed. But it could,
done, sorry.
it could be, sorry?
Was it done, Debbie? Is that what you said?
That was done too, sorry.
Okay, sorry. But it could definitely be stress related, especially, if your cat is a very stressed cat. Sometimes they develop these kind of OCD behaviors where they'll overlick themselves because of stress, and then that licking can cause infection, which makes it more itchy.
Right.
So that is for sure a possibility when you rule out any other causes.
So I'll just keep using the cream then, hope it goes away. I mean, it seems to be doing okay right now. It's just that on the dexamethasone, he's a crazy cat. It really affects him. I don't want to keep him on that.
And just a quick question, does the cream have steroids in it?
Well, one of them was called Fusidin. It did, but this is another one. I don't know the name because I'm blind. I wouldn't be able to even look right now because my husband's not here. But it's they use it mainly for dogs, but it can be used on cats, and it seems to be working. It's a gel.
Okay. Just make sure if there is a cream that contains steroids, just to use it not constantly, a maximum of 7 to 14 days, and then give it a break, just because overusage of steroids on the skin can thin out the skin and then can cause lesions that are like red.
Okay.
So it can make things look worse. Yeah.
All right, Debbie, thanks very much for the call. Let me head over. Well, I got another. Let's do Debbie back to back here. Debbie, downtown Debbie. What do you say, Debbie? What's your question?
My question is because I was evacuated from my building last year, and a lady told me at a pet store about this disease called the Cushing disease. I don't know if I'm pronouncing it right, but she told me when an animal gets stressed, they can create certain type of hormones and stuff like that. And my dog, I lost my cat and that from the move and that because we were separated from one another until around 3 months until I got into another apartment and that. And I think it was spelled Cushing.
Cushing. Is that familiar, Dr. Skoulikas?
Yes.
Okay. So
yes.
What's your question, Debbie?
Well, my dog right now, I've been taking her since last November. I lost my cat in December. With clogged arteries, and I've been taking my dog in that she's 12, going to be 13 years old coming up next month, and she keeps on getting these lumps inside of her. I know she has one is a fatty tissue. I already got that tested, and there's no cancer or anything, but every day I touch her, she's getting more lumps.
Dr. Skoulikas, what do you say there?
So depending on the breed, certain breeds are more predisposed to getting fatty tissue lumps. So also, like little warts can come up as they're older. And at 12 years old, I'm not surprised that little lumps and bumps start forming. So as long as you always get them checked by your veterinarian just to make sure that they're not cancer, that's important. Okay. And in terms of Cushing's disease, it is categorized by increased cortisol levels, so the stress hormone. But technically, it's not really a disease that is caused because an animal went through a stressful situation. It's usually caused by either a tumor on the adrenal glands or a tumor in part of the brain that can control the secretion of cortisol from the adrenal glands. And I'm really sorry about the loss of your cat.
Oh, thank you so much for that information. Thank you.
Thank you, Debbie. Appreciate it. Taking your pet-related questions at 514-790-0800. Dr. Sophia Skoulikas is with us from the Liesse Animal Clinic in Dorval. We head over to Crystal in Montreal. Hi, Crystal. What's your question?
Hi, good morning. I've seen those handheld, I think they're called cold lasers that you can use on your dog for joint pain and stuff like that. I was wondering if they actually work or if they're worth your money.
Ooh, joint lasers, doctor. What do you say?
Cold lasers.
Cold lasers.
I'm a big fan of lasers, pretty much called photobiomodulation, a big fancy word. It's just you need to be careful about using them just to make sure that you have the appropriate frequency for a joint versus muscle versus skin, because these lasers, depending on the frequency, can penetrate deeply or superficial. So that would also determine if it's something that helps or not. The reason I believe in it is because my cat does physiotherapy and we do laser on him, and I see a difference. And I do laser on myself too when I have an injury, and I actually really see a difference in the reduction of pain and comfort associated with like arthritis or anything else really. So I'm a big fan of it.
Yeah.
Do you have a frequency that's a good frequency to put it on, or?
The frequency means like the wavelengths of the actual light. So my suggestion to you is if you are interested in buying something like that, I would first consult with your veterinarian and then see if you can see a veterinary physiotherapist, which are usually technicians, and have like a first consult with them. They usually have laser that they use, and then you can ask for your pet what frequency of light would be appropriate for your pet.
Okay, thank you very much for your help. Have a great day.
And thank you for the question, Crystal. You learn something every day. I had no idea these things existed, and now I'm like, okay, do I have to buy a laser for myself? My goodness. Again, consult your doctor if you're going to use lasers on yourself. But that's very interesting that exists for pets and that it's so useful. Okay, let's continue this going here. I'm going to, who's been waiting a long time? Donna is in Vadroy. Hi, Donna.
Hi, I've got a question about my 18-year-old cat. She recently started peeing in different spots, and I noticed there was blood in the urine. I took her to the vet. They put her on a venti, something for urine, but they did a blood test, they did a urine test. Everything came back okay, and they asked me if anything had changed in my household or with the cat lately. My dog died in September, and she was really close to the dog. They're saying that could have caused an inflammation, not an infection, because of hormones that get released. Is that possible?
Yes, with cats, that is possible. They're very peculiar little creatures, and extreme stress for a cat causes inflammation, specifically in the bladder, which can cause things like bloody urine and things that look like there's a urinary infection. And in male cats, could even cause like urinary blockages sometimes. So that is a possibility once, we rule out anything else like a cancer or an infection.
Is that answer? Yep.
I could tell he's really missing him because she used a rubber head against him, and then they would, she would like clean him, and since he's gone, she follows me around 24/7. But I never thought that emotionally that it could cause something physical for her.
It's a broken heart can have these effects.
Oh, well, I miss him too, but now I'm really feeling bad for her, but she seems to be okay. Now when she urinates, I stick a Kleenex under her just to check to see if I can see pink or red, and everything seems fine now.
Okay. Good. Oh, I'm so sorry for both of you.
Yeah.
Well, thank you so much.
Donna, thank you for calling. A very fascinating, interesting question there. Let's head over now to Kay, who has a question about her cat in Saint Laurent. Hi, Kay.
Hello.
Hi, what's your question?
My question is, my cat was born in 2008, so it's about 17 years old by now, rather old, and he's losing a lot of weight and very, very skinny. He barely eats, and he has these weird meows lately that are very loud and some unusual that I'm not used to. And I'm just wondering if he's in a lot of pain.
What are your thoughts? What are your thoughts, doctor?
Yeah, that's a good question. It's definitely hard to evaluate without having the patient in front of me.
Right.
But rapid weight loss in an elderly cat, it's always concerning. It's really important that she gets seen by a
Sure.
vet, not only to maybe see if there's something like diabetes or hyperthyroidism or kidney disease, but also to evaluate her quality of life so she's
Right,
not in
right,
pain.
yeah. Well, I think at 17 years old, is that old for a cat or is that more normal?
I mean, it is pretty old for a cat at 17.
Because he's
Once they get
skin
to
and bones.
17,
Sorry, he's skin and bones at the moment.
Oh,
yeah, that's not a good sign.
Okay. Oh,
yeah.
thank you. I really appreciate your help.
No problem, Kay.
Thank you very much.
Go see your vet. Appreciate you calling. All right, let me squeeze in Michelle and Brossard. You have a question about your dog, Michelle?
Yes, so we have a Wheaton Terrier, and we were just wondering he's never had his teeth cleaned. He's 8 years old. Is this something that is suggested, or because we brush his teeth, and we ordered online this product called Iron Paws, which is apparently full of great ingredients for the oral health. I just don't know if that's sort of just a marketing thing, or is it your suggestion that he be seen? I'm just concerned because it requires him to be put under general anesthesia, and it's always so sad to see him come back from those appointments so sort of out of it.
Yeah.
So.
Yeah, it's definitely, the big scare, even for my animals when they go under general anesthesia. There's, always the risk, so there's always that stress. But for a Wheaton Terrier, 8 years old, I mean, really it depends on the tartar that's on the teeth. So if there is tartar, especially if there's some gingivitis, then I do recommend getting a teeth cleaning done for sure before that tartar gets worse, goes deeper. There's bone loss and then, instability on the ligament that holds the tooth. And then you could have issues like losing teeth or having to do extractions, which increases anesthesia time. And when the anesthesia time increases, that's when you start getting more issues. So a dental cleaning usually isn't very long. So you want to, you prefer doing dental cleaning so you can save the teeth and not have to go through longer anesthesia.
Have you heard of this Iron Paws product?
I have not,
Okay.
but there is a great website that you can check. It's called the Veterinary Oral Health Council, so VOHC. And they have great recommendations for anything regarding oral health, what to give, what not to give, things that could cause fractures. And they have products that they recommend that can potentially help reduce the amount of plaque or tartar that's on your pet's teeth.
Michelle, I have to leave it there. I hope you got
Thank
the
you.
answers you needed
Thank
there.
you.
And we do have to leave there. Can't get to everyone this morning, as usually happens on these segments. Don't forget, we do this on the first Wednesday of every month, so you can join us for the first Wednesday of December as well. Dr. Skoulikas, Sophia Skoulikas, thank you so much for coming on today. Really appreciate it. I'm getting some wonderful comments about you as well off our text line.
Oh, you're welcome. It's really fun. I love doing this.
And you can find Dr. Sophia Skoulikas. She's a veterinarian in general practice at the Liesse Animal Clinic in Dorval.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian owned and operated. Charm has been part of your love stories and bromances for over 50 years. And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.